All right. Good evening, everybody. Um, Tonight, we have a great program for you, Heel Pain Causes and Treatments with Dr. Swanson. Um, so no further ado, I'll pass it on to you.
All right, thank you, Aaron. Hi, everybody. I'm Kyle Swanson, a podiatrist at KSB Foot and Ankle Center. I'd like to thank Aaron for having us tonight. I do have a special guest with me as well, Dr. Beth Reidinger, one of our residents. So we would like to present heel pain for you this evening. Tonight we'd like to cover causes, symptoms of heel pain, and various treatment options. I wanted to include this first slide here to inform everybody how many things we really have going on around our heel bones. We have 28 bones in our feet, 33 joints, 107 ligaments, 19 muscles and tendons. So the 56 bones in our feet make up over a quarter of all the bones in our body. So when we are identifying and diagnosing heel pain, we really have to keep into account what is all going down or going on in our feet. This next slide has some interesting facts as well. So our average stride length when walking is approximately 2.5 feet. During a mile, then it takes about 2,000 steps. An average person during the day takes 3,000 to 4,000 steps. Many people do more than this, but when running, 2 to 4 times of the body weight is forced upon our feet. So this is a lot of force on our heels, which can cause the injuries and conditions that we see. So in regards to heel pain, one of the most common conditions we see is plantar fasciitis. So what is this? Well, there's a ligament on the bottom of our feet that attaches from our heel out to our toes, and patients can experience pain with first steps in the morning or when standing after sitting for long periods of time. There are a large variety of other causes of heel pain. Some to mention are stress fractures, tarsal tunnel syndrome, bursitis, which is inflammation of fluid-filled sacs around our heels, bone spurs, tumors, and also Achilles tendonitis. So heel pain symptoms. Well, number one is going to be pain. Like I mentioned, first steps in the morning or after activity, that may be the worst times of this pain. It may even progress to not being able to bear weight at all. The location of the pain is very important as well. It can present on the bottom, it can present on the back, it can even be the whole heel bone itself. There are joints around the bone that we have to keep into account. Also, patients may be experiencing knee or hip pain. When we hurt, we compensate, and this stresses certain areas of the body that aren't used to being stressed as much, resulting in pain. A lot of times, heel pain is originating from a deformity called Equinus Deformity. What does this mean? Well, this means that the back of our legs are very tight along the Achilles tendon. The word equinus stems from equine or horse. So if we think about a horse's hoof pointing straight down to the ground, that same concept is what we correlate into how much ankle range of motion we get. We have difficulty bringing our toes and ankles up when we're walking. A tight Achilles is the most deforming force of the entire foot and ankle, so very important to address this. Equinus can cause flat foot, neuromas or inflamed nerves, plantar fasciitis, Achilles tendonitis, and also metatarsalgia, which is pain under the balls of our feet. So treatment options for Equinus, well, number one is stretching. Stretching is by far the most important thing that we can do. We typically recommend stretching 3 to 5 times a day. There are various stretching techniques as well. The image in the middle of the screen, this is what's called the runner stretch, where we keep our legs straight, our heel is on the ground, and we do not bend our knee. We feel that stretch in the back of our leg. And then we bend our knee, keeping our heel on the ground, and that gets the deeper muscles and the lower muscles as well. Holding these stretches for approximately 10 to 15 seconds so you feel a nice pull but no pain is the appropriate way to stretch. A lot of times we can incorporate physical therapy as well. We work really close with our physical therapy department. They do a fantastic job of helping us stretch and utilizing other modalities to help alleviate tightness in the back of our leg and other heel pain etiologies and conditions. This last bullet point is gastrocnemius recession. So what this is, if conservative treatment fails, there are other procedures that we can do surgically as well, but a gastrocnemius recession is a surgical option to gain flexibility in the back of our leg. This image to the right shows where in the back of our leg, at that region, we transect or release or cut a portion of this tissue, and that will enable us to have more flexibility in the back of our legs. So like I mentioned, physical therapy can be an extremely important part of heel pain and treatment. The stretching, that first bullet point, once again, number one treatment we can do. Strengthening structures around our heels, our entire lower extremity can help alleviate and get rid of pain as well. And then balance and proprioceptive training. So what is proprioception? Well, that is our sense of position in space. So the way I like to think of it as is if we are standing with our eyes open, it's a lot easier to keep our balance rather than standing on one leg with your eyes closed. And so therapy can be very useful in improving our balance. All right, I'd like to turn it over to Dr. Beth Reidinger now. She's going to talk about heel pain treatments.
Hi everyone. So some different treatment options for heel pain include shoe inserts. You can get two different types of inserts. One is over the counter, and different healthcare providers can recommend different types. And then there's also custom made orthotics, which are custom casted to your foot. Those are the best type of inserts, obviously, because they're custom to your foot. You can also do corticosteroid injections. If you have plantar heel pain or bottom of the heel pain, that's a good option. It helps with inflammation and swelling, or inflammation and pain, sorry. However, if you have back of heel pain, so Achilles tendonitis, that is not an option because the steroid can actually be detrimental to that muscle tendon. But because the bottom of the heel pain is a ligament, that's what actually helps with the inflammation and pain. And then another modality, which isn't used quite as often anymore, but some physicians do use it, is taping and padding. So Dr. Swanson already went into pretty good detail with stretching. It is very important. Another thing you can do too is if you have pain on the bottom of your heel, you can freeze a water bottle and then roll it on the bottom of your foot, and that's going to help massage that tissue and also help with the swelling as well. So another important thing is body alignment. If we're having heel pain and issues with the foot, it's a chain reaction to all the other joints in your body, your knees, your hips, even your shoulders. So if you've ever been to a bone or joint doctor, they might have done a gait analysis on you. So we see the way you stand and also the way you walk. So as you can see, the imbalanced person in the picture here, their shoulders dropped, the pelvis is tilted, the knees are rotated in, and then the foot is actually pronated. So yes, that's very important. I lost my screen here, I apologize.
Do you want me to? Okay. You want to jump in? Yeah, I think I'm still. Yep.
All right. I think we're back on. Sorry for the technical difficulties, everyone. So another important thing in your feet specifically is your arches. I'm sure everyone's heard about this before. You can have three different types. So you can have overpronation, also known as flat feet, and in the medical field we call it pes-planus. You can have a neutral arch, which is neither high nor low, or you can have underpronation, which is known as a high arch, or in the medical field we call pes cavus. And you can see an example of each type of those in that image there. And then the knees as well, also very important. So you can have different pathology with your knees as well. Knock knee, also known as genu-valgum in the medical terms, which your knees are close together, which causes your feet to be more farther apart, and that puts more pressure on the outside of your knees and then the inside of your foot. You can have neutral, which is obviously what you want. So there's a central alignment between your hips, your knees, and your feet. And you can also be bow-legged. So your legs are bowed at the knees, and then your feet are closer together, which causes more pressure to be on the inside of your knees and the inside of your feet when you're walking. So in conclusion, heel pain is very common. It's one of the most common things we see on a daily basis in our practice. We went through many different causes. It's not always just that plantar fasciitis. That's why it's important to come in as soon as possible to get figured out what's causing it so we can help it get resolved as soon as possible for you. Again, that stretching is the most important thing for symptoms and for resolving the issue. And then also supportive shoe wear and those inserts that we talked about. And that's really all that we have for you. And I can turn it back over to Dr. Swanson to finish this up for us. Thanks, everyone.
All right, thanks, Dr. Redinger. Great. Well, I hope that was informative for everybody. I'd like to just remind you, with heel pain, it's important to get the correct diagnosis. The sooner we can do that, the sooner we can get you treated and the sooner we can get you back on your feet as well. So down below, if you'd like to leave any comments or you have any questions, we'll definitely get back to you. There's an evaluation as well. So we thank you in advance for that as well. And thanks again for joining us tonight, and everybody have a safe and happy holiday season. Thank you.